The Trump administration's proposed budget for 2018 would make sweeping cuts to Medicaid as well as to the agencies and programs that propel the nation's engines of science and biomedical research. The administration released a skinny budget in March that included sharp proposed cuts to biomedical and science funding. The blueprint prompted harsh blowback from scientists and public health professionals alarmed by the potential long-lasting damage of such dramatic reductions in funding. It also received a cool reception from Republican lawmakers. But the administration's fleshed-out budget, which was posted online prematurely on Monday and then quickly taken down, indicates the White House is determined to stay the course. In a nod at that austerity, the document says the budget focuses resources on direct services and proven investments while streamlining or eliminating programs that are duplicative or have limited impact. Some of the most significant cuts. Medicaid would face a cut of $610 billion over the next decade, on top of the $839 billion that would already be cut under the proposed American Health Care Act that passed in the House earlier this month. It wasn't immediately clear exactly where the $610 billion reduction would come from, though the document pointed to per capita caps, block grants, and new forms of flexibility for states. The National Institutes of Health's budget would be reduced by 18% from 2017 spending levels to $26 billion. The National Cancer Institute would receive $4.47 billion, down 19%. As with the skinny budget, the new proposed budget eliminates an NIH program, known as the Fogarty International Center, that promotes medical research overseas. The Centers for Disease Control and Prevention would get $6.3 billion, down 17%. $934 million would be spent on HIV/AIDS, viral hepatitis, sexually transmitted infections, and tuberculosis prevention, down 17%. The CDC's Global Health Program, tasked with combating disease outbreaks overseas, would get $350 million, down 18%. $157 million would be spent on environmental health, down 28%. Spared in that cut is $35 million to prevent lead poisoning in children, an allocation spurred in part by the water quality crisis in Flint, Michigan. As with the skinny budget, the Agency for Healthcare Research and Quality would be eliminated as a standalone agency. Many of its functions would be rolled into the NIH. The FDA would get $1.89 billion in direct government funding, a decrease of 31%, or $854 million. But that loss would be offset with an increase of $1.3 billion in user fees, paid by drug and device makers seeking approval for their products. $403 million would be cut from physician training programs. When this cut was proposed in the skinny budget, critics feared it would impact programs for students pursuing joint MD and PhD degrees. The deep cuts to the NIH drew immediate condemnation from advocates for biomedical research. The proposed budget would be a travesty for patients and the future of personalized medicine if enacted, said Edward Abrahams, president of the Personalized Medicine Coalition, which represents patients, insurers, healthcare providers, and others. Dr. Ross McKinney, chief scientific officer of the Association of American Medical Colleges, said by email late Monday that some parts of this budget proposal do not make sense. He said more NIH research funding is essential. On Capitol Hill, Tom Cole, a Republican congressman from Oklahoma, called the proposed cut to NIH penny-wise and pound-foolish and the cut to the CDC a really bad mistake. Cole chairs the House Health Appropriations Subcommittee. It's a good place to start the discussion from, but I don't think it's likely to occur, Cole said of the proposed cuts to the NIH budget. I don't think it could be passed, honestly, through the House, and I'm certain it can't be passed through the Senate. Andy Harris, a Republican congressman from Maryland and a doctor who has conducted NIH research, said he supported a provision to cap the level of indirect costs as funded by NIH grants, but that he would oppose an NIH cut of this magnitude if the provision was not included. It's possible the budget proposal briefly posted on Monday could still change. Alima, a spokeswoman for the Department of Health and Human Services, said on Twitter that the official version would be released on Tuesday morning. President Trump's 2018 budget request to Congress seeks massive cuts in spending on health programs, including medical research, disease prevention programs and health insurance for children of the working poor. The National Cancer Institute would be hit with a $1 billion cut compared to its 2017 budget. The National Heart, Lung and Blood Institute would see a $575 million cut, and the National Institute of Allergy and Infectious Diseases would see a reduction of $838 million. The administration would cut the overall National Institutes of Health budget from $31.8 billion to $26 billion. The proposed cuts to the U.S. Centers for Disease Control and Prevention drew an unusually sharp rebuke from former CDC Director Tom Frieden, who went on Twitter to describe the administration's CDC request as unsafe at any level of enactment. Would increase illness, death, risks to Americans, and health care costs. In a separate tweet, Frieden listed what he sees as the dire ramifications of the Trump proposal, saying, for starters, that it devastates programs that protect Americans from cancer, diabetes, heart attacks, strokes and other deadly and expensive conditions. The full budget document is scheduled to be released Tuesday morning, but either by mistake or design, the administration posted the section dealing with the Department of Health and Human Services late Monday afternoon. The document was soon taken offline but can be read here. The only official version of the HHS budget will be released by the Office of Management and Budget at 11 a.m. tomorrow. At that time, Budget Director, Mick Mulvaney will hold a press briefing and address any questions, HHS National Spokesperson Ali Maher wrote in an email to the Post. The slashing of programs that normally have enjoyed bipartisan support is part of the Trump administration's effort to trim trillions of dollars in spending over the next decade while at the same time paying for tax cuts and increases in military spending. What Trump's 2018 budget cuts from the social safety net? Trump's Office of Management and Budget produced a skinny budget in March, in effect an outline with few details, and that document delivered a number of surprises, including a call to cut nearly 1/5 of National Institutes of Health budget and nearly 1/3 of the Environmental Protection Agency funding. Lawmakers appeared to ignore that budget request entirely when putting together a spending plan for the rest of fiscal 2017, which runs through September. Much of that spending plan had been in the works before the November election. It is unclear how Congress, which has the power of the purse, will treat this new and more detailed budget request. But the document posted late Monday shows that blowback from that earlier budget request did not dissuade the administration from its strategy of cutting non-military discretionary spending to pay for tax cuts and a boost in the Pentagon budget. Funding for the Children's Health Insurance Program, CHIP, would be slashed by at least 20% for the next 2 fiscal years. According to the budget document, the administrator favors a renewal of CHIP, a program created 20 years ago for the children of lower working-class families and which currently insures 5.6 million children. The spending plan would, however, eliminate an element of the Affordable Care Act that increased by 23% the portion of the program's costs that is paid for with federal money, leaving states to shoulder a larger share. It would also for the first time essentially limit states' eligibility levels to qualify, saying that the government would no longer help cover children from families with incomes of more than 250% of the federal poverty level. Currently, 18 states plus the District of Columbia allow families with incomes higher than 300% of the poverty line to sign up their children for CHIP, according to data from the Kaiser Family Foundation. The Trump budget asks for cuts to several key programs at the Centers for Disease Control and Prevention, which responds to disease outbreaks in the United States and around the world, makes sure food and water are safe, and helps people avoid heart disease, cancer, stroke and other leading causes of death. The president's budget seeks an $82 million cut at the center that works on vaccine-preventable and respiratory diseases, such as influenza and measles. It proposes a cut of $186 million from programs at CDC's Center on HIV/AIDS, viral hepatitis, sexually transmitted infections and tuberculosis prevention. One of the biggest cuts, $222 million, is to the agency's chronic disease prevention programs, which are designed to help people prevent diabetes, heart disease and stroke, and obesity. Some of those funds are being channeled into a new $500 million block grant program to states and territories to focus on leading chronic disease challenges specific to each state. Critics have said block grants allow states to plug holes in their budgets, without accountability that federal programs require. The agency's Center on Birth Defects and Developmental Disabilities also gets a 26% cut to its budget at a time when researchers have yet to understand the full consequences of Zika infections in pregnant women and their babies. The budget calls for a 17% cut to CDC's global health programs that monitor and respond to disease outbreaks around the world. It also cuts about 10% from CDC's Office of Public Health Preparedness and Response. The budget document highlights $35 million that the CDC spends on childhood lead poisoning prevention. But the overall spending on environmental health would under Trump's plan be cut by $60 million, down to $157 million, according to the document. Trump administration officials have also proposed the establishment of an emergency response fund to respond quickly to emerging public health threats. In the wake of the Ebola and Zika epidemics, U.S. officials have repeatedly called for the need for such a fund. The budget does not provide a specific amount. It says HHS would have department-wide transfer authority to support the fund in the case of a natural or man-made disaster or threat. The fund would be available to receive a transfer of up to 1% of any HHS account, without any limitation on the total, for use in emergency preparedness and response. The Food and Drug Administration would see a cut from $2.74 billion to $1.89 billion. User fees paid by manufacturers of drugs, devices and other products would be increased by close to $1 billion to pay for product reviews. Republican Senator Lamar Alexander of Tennessee, the chairman of the Health Committee, has said he does not want to reopen negotiations with the industry over fees that it pays to support FDA activities, as the Trump administration has previously suggested. His committee recently approved legislation that ignores the administration request.